Hopefully, everyone can hear me well. Let's get started. So, hi everyone. We really appreciate you tuning in today for our conversation about the No Surprises Act. My name is Jane Sheehan, and I am Director of Relations at Families USA. Now, a little bit of background. Families USA and our partners in the consumer and patient advocacy community have been fighting for years to ensure that patients and their families are protected from surprise medical bills. Surprise medical bills, which we'll talk a little bit more about, they are a market failure and system abuse that have plagued consumers for decades and have raised costs for everybody with commercial insurance. For those who might not be as familiar with the No Surprises Act, it's a landmark bipartisan law that passed Congress in December 2020, and it protects consumers from most out-of-network surprise medical bills and also helps to rein in healthcare costs. So today, we're going to talk a little bit about the importance of the law and what some recent regulatory actions mean for consumers. And then we're going to hear from a consumer who knows firsthand how harmful a surprise medical bill can be. We're also going to kind of wrap up and share some resources to help consumers better understand their new rights and to help get the word out about the protections. So, the No Surprises Act has now been in action helping people since January 1st of this year. And data shows that in January and February alone, over 2 million surprise bills were prevented. So that means the law is working and protecting consumers, and that's a really good thing. Prior to the No Surprises Act, out-of-network balance bills were hitting millions of families each year. 1 in 5 emergency department visits resulted in a surprise bill, and nearly 70% of their ambulance patient transports were out of network. So these surprise medical bills were particularly egregious because they're unpredictable for families and occurred despite every effort people make to avoid them. There's also really strong evidence that the abusive practice of balance billing has contributed to higher premiums and healthcare costs for everyone with commercial insurance. So this is all really was a result of a systemic problem that placed families in the middle of this tug of war between healthcare providers and insurers over the price of care. So the No Surprises Act is in the news again this week because last Friday, the Biden administration released some final rulemaking around a piece of the law that essentially kind of covers how the process works for insurers to reimburse providers for their work. And these pieces of the law, what was worth paying attention to, and it's important for consumers because it has the potential to impact costs in the healthcare system overall. And if that payment process and that reimbursement process results in higher and higher payments, consumers are going to feel that through increased premiums. So Families USA, in our analysis of the new regulation, is really overall pleased with this rulemaking. There's a lot to dig into. We're not going to cover all of that today. But our major takeaway is that in this rule, the administration took a really thoughtful approach in attempting to keep a fair local market payment at the center of those reimbursement decisions. And that's potentially going to be a really important, strong guardrail against rising healthcare costs. So in the weeks and months ahead, we're going to be working with our partners, working with the administration, and encouraging them to continue to really monitor and report how this process is working, what the outcomes look like to ensure that the No Surprises Act continues to work as intended and can lower healthcare costs. So if you are just tuning in, I'm Jane Sheehan of Families USA, and we're talking about the No Surprises Act today. And really, we want to talk about how we keep the law strong and working for consumers so that they're no longer placed in these impossible situations where they're made to question whether their health or the health of a family member is important enough to risk a trip to an out-of-network ER, or whether they can afford to get a needed treatment or procedure because their anesthesiologist might not be in contract with their insurance. Those are really awful positions to be in. So I think to illustrate how easily patients and their families have been pulled into this tug of war prior to the No Surprises Act, I'm going to turn it over now to Nikki Polk, who is kind enough to join us today and to talk about her experience of getting a surprise medical bill and knows firsthand how burdensome this could be. So Nikki, if you're ready, I'll turn it over to you.
Terrific. Thank you, Jane. And huge thanks to Families USA for being such an engine behind this bill, and the impact that it's having is immeasurable. I can't even underscore that. So about 4 years ago, almost to the day, for my 50th birthday, I decided to run a high altitude relay race up near Mount Hood. And I'm a seasoned marathon runner. I was about 3 weeks out from running the Berlin Marathon. So needless to say, I was in good shape, good health. But I had a bit of a lingering chest cold, and they'd had some fires up there. So the air quality was not amazing. And after the race, I was feeling a lot of congestion, and my voice was gone. So anyway, I went to a doctor, and she said that my chest cold had turned into bronchitis, and she prescribed Zithromax and said also to take some Mucinex, and everything would be fine. So I went home, I took medication, and I pretty immediately started feeling really, really lousy, like alarmingly lousy. And I'm someone who, rarely has to go to the doctor. I have 2 kids, and I've taken them to the ER, on occasion, so I know the drill. But I had a really rapid heart rate. I was about 110 beats per minute, which is like twice my resting heart rate. I was having difficulty breathing. My fingers um, and feet were starting to go numb. I had ringing in my ears. I was dizzy. Like all kinds of things had pointed to some kind of reaction to the medication. And so I called my downstairs neighbor, and she rushed me to our closest hospital, which is about a mile away. And the last thing I did was pull out my insurance plan to see whether or not this hospital was in network, because you assume that any hospital on the planet is ready to receive someone in an emergency situation without regard to whatever their insurance plan is. So I was in pretty bad shape because I wasn't even able to walk down the hallway by myself. They had to throw me in a wheelchair. Um, so they ran a number of tests. I had an EKG, I had a chest X-ray because they wanted to rule whether or not I was having a pulmonary embolism, and I had some blood tests because they wanted to see if I had some kind of a clot. And 4 hours later, things started to calm down. My heart rate was getting back to normal, and I had a lot of like I still was having strange voice issues, but they released me. Everything seemed to be like getting back on track, and I was discharged with a diagnosis of quote shortness of breath and viral syndrome, whatever that means. So anyway, feeling better the next day. A month later, I get a bill in the mail from San Francisco General Hospital for $13,000, and my first thought is, hey, I have a great insurance plan through my employer. It's a PPO plan. This will get taken care of. And no, it turns out that the amount that my insurance plan was able to cover $3,000 of that. So I was left with a balance of $10,000. And it was because the hospital was out of network for my plan. And under those conditions, the insurance plan would only cover what was considered the Medicare rate. And clearly the hospital was charging significantly more than what Medicare allows for. And so I was thrown into this like really arduous 5-month process of like navigating the underbelly of the US healthcare system. And I called a health advocate, and sat down with her and tried to figure out what my options were. She suggested that I draft an appeal letter. So I got an attorney and we drafted an appeal letter to them. And, they rejected that pretty quickly. I researched what kind of state legislation we had, which in California is actually quite generous. But it doesn't cover hospitals that are out of network. It's out of luck on that. And I studied the charge masters, which honestly is like the last most interesting thing that you can do on a Saturday morning, is to look at hospital charge masters and look at what they're charging for different things. Just as like a frame of reference, they charge $16 for an N95 mask. So you can imagine how much more they're charging for EKGs and things like that. And they had this random line item on my bill that basically qualified me as a level 5 emergency, and that's costing $11,000 out of the 13, with no explanation of what that mysterious line item is. And so I was comparing notes with other patients. I amassed about an and a half of paperwork back and forth with insurance providers. And then I started getting the past due notices and the threats of having my account sent to collections, which is such a great feeling, because you realize like you have the choice between just swallowing hard and paying this $10,000 balance and having the hospital, threaten to destroy your credit. And so, through there was a significant media coverage about other patients that were dealing with the same thing. It reached national media attention, and so I sort of was able to hook into that. And I think because of that, and because my employer went back to United Healthcare and tried to kind of use the fact that they have a large number of employees that are using their plan, we're finally able to get my insurance provider to basically cover the balance, which is not the outcome that I wanted. I wanted the hospital and the insurance company to negotiate and figure out something in the middle and take me out of the process, which I think is the biggest benefit of the No Surprises Act, is that you no longer have patients who are stuck in the middle, with this ridiculous back and just trying to like juggle, trying to understand all of the different routes and options that they have. And I was advantaged because I had resources, I had people I could talk to, I had lawyers I could call. There are people who have all the time and fewer resources, and they were really disadvantaged and couldn't do much about it. So it's amazing that this is all a thing. I think there are still loopholes. I think there are still hospitals and providers that are trying to figure out ways around this. But overall, I think this is just an incredible thing for American consumers, and I'm really grateful to the Biden administration and the rare bipartisan congressional effort to pass a bill and to keep it going strong for consumers and make sure that we don't end up in situations where people are having to spend their free time fighting for something that really should be a basic American right at this point. So with that, I will pass it back over to Jane.
Nikki, thank you so much for sharing your story. I mean, I think your experience spending so much time and effort trying to dispute the bill is really all too common. Time that should be spent recovering and focusing on your health, your family's health, is spent running paperwork and being caught in the middle of these payment disputes. And it really is because of people like Nikki who have been able to kind of speak out about their experiences that I think we were able to get Congress to pass such a strong law for consumers and for the administration to really continue to center consumers in their implementation of the law, which is what I think we really hope to see going forward. So if you are just tuning in, I'm Jane Sheehan of Families USA, and we're about the No Surprises Act today and what it means for consumers. And I think, to follow on to Nikki's story, the good news is that today the No Surprises Act is protecting people like Nikki who have a medical emergency or even have scheduled care but don't have control over whether, their emergency department team or anesthesiologist or surgical assistant participates in their insurance network. We really want to continue to push out information about these new protections and make sure people know what they're entitled to. So I think some key things to know now for consumers is that if you have health insurance through your job or a family member's job or a plan that you bought through the marketplace or the individual market health insurer, the No Surprises Act, can protect you against unexpected bills for care that you're getting out of your plan's health network. So what does this mean? If you have a medical emergency and are seeking care at a hospital, a freestanding emergency facility, such as urgent care that does provide emergency services, or if you're using an air ambulance, you can't be charged more than your health plan's deductible copay coinsurance, also known as cost sharing. And this is going to apply whether or not the emergency services provider is in your insurer's plan or not. And if you're receiving non-emergency services from an in-network hospital or ambulatory surgical facility, you can't be billed extra for using certain out-of-network services, including anesthesiology, lab work, pathology, x-rays and radiology, neonatal care, or care from a hospitalist, assistant surgeon, or intensivist. Other kind of key pieces of this law for consumers about is that insurance plans really, they have requirements to keep their healthcare provider directories up to date. So if a directory says a provider is in your network and you go get that care, you can't be billed out-of-network rates by that provider. Also, if you're uninsured or planning to pay the full cost of care out of pocket, you can get ahead of time, you can request an itemized estimate of the charges before you get that care. And that's called a good faith estimate. If the actual cost of care is $400 greater than that estimate for any individual provider, then you can dispute those charges. So if you're a consumer or a consumer advocate who, if you believe you've been surprise billed yourself since January 1st, or you're trying to help out somebody else, or you just want to learn more, we really encourage you to go to cms.gov/no surprises. That's kind of the official website with all the information there. Or you can call the CMS No Surprises Help Desk. That number is 1-800-989-3059. Again, I think cms.gov/no surprises is we can get all the up-to-date official information. And then Families USA is going to continue to work to kind of put out more resources to help consumers. We have a new consumer-facing fact sheet on our No Surprises site. So that's nosurprisescampaign.org. And we can share that in follow-up in our feed. And, that just has some frequently asked questions, kind of a summary of these protections, some step-by-steps of how to, dispute a good faith estimate complaint. And if you or someone has been impacted by surprise bills, we'd also just love to hear from you and see if you'd be comfortable sharing your story and getting the word out more. So if you have a story to share, we would love for you to reach out at familiesusa.org/stories, or just, I think, DM us on Twitter is another good way if you're listening live today. So, in closing, I just want to sincerely thank Nikki again for joining us and sharing her story. I think, Families USA and all the advocates who worked on this really want to thank the policymakers, their staff, all of the stakeholders and advocates that really pushed to get this law across the finish line. And we're also just really grateful for the work of the Biden administration for going through a really strong rulemaking process, incorporating critical feedback from consumers, providers, payers, stakeholders across the country, patients themselves. This feedback, I think, has really helped to ensure that strong protections for those seeking medical care exist and there are reasonable guidelines for providing that care. So, this all is just going to help improve healthcare affordability, which I know a lot of us are thinking about these days, and move us closer to a place where no one has to choose between going to the doctor and paying their mortgage or rent. So I think if any of our listeners kind of want to talk more about this, if you have questions about the No Surprises Act and what it means for consumers, you can DM us at Families USA. You can send me an email, jsheehan, JSHEEHAN @familiesusa.org. And we would love to talk further. And again, really appreciate everyone's time today. I think this will wrap it up. Thank you.
Thanks, everybody.